Thank you so much for tuning into the program. I'm your host, Neal Howard, here on Health Professional Radio. Our guest is John Lehr. He's CEO of the Parkinsons Foundation, and he joins us here on Health Professional Radio to discuss the foundation's mission and their work around the world for the needs of people with Parkinson's disease. Welcome to Health Professional Radio, Mr. John Lehr.
Thank you, Neal. It's a pleasure to be here today.
You are the CEO of the Parkinsons Foundation. Are you a healthcare provider?
Yeah, so I'm not a healthcare provider. I'm not a medical professional. I have worked, however, in the healthcare and the medical field my entire professional life, mostly on the fundraising, initially on the fundraising side, and then more recently on the management side. But I do love the science. I love working on behalf of people who are affected by difficult and challenging diseases, and to see whether we can find ways through scientific discovery or through better care to improve their lives.
Now, the Parkinson's Foundation is involved in research that advances, basically gives better care and treatment for those who are dealing with Parkinson's. Are you involved in any other types of research, or is it strictly Parkinson's and Parkinson's-related difficulties?
Yeah, so the foundation that I run, Parkinson's Foundation, actually resulted from a merger last year of two smaller legacy organizations, the Parkinson's Disease Foundation based in New York and the National Parkinson's Foundation based in Miami. Both were founded coincidentally in 1957 and have been working on behalf of people affected with Parkinson's ever since. The focus really of our organization is there's a number of key areas that we look into. One is we are investigating the clinical outcomes of people with Parkinson's to see whether we can identify therapies or different treatment modalities that will improve their overall functioning and their quality of life. And we also invest in research that's called basic research. That's lab research, animal model research, to gain a better understanding of Parkinson's, the disease itself, what's going on in the body, why do people end up with a diagnosis of Parkinson's, what can they expect with the diagnosis of Parkinson's, and what can we do to set up therapies that will allow them to either, to prevent, to arrest, or to ultimately cure Parkinson's.
How many people would you say are suffering from Parkinson's in the United States? And if you have worldwide numbers, discuss those as well.
Yeah, so Parkinson's in the United States, we think the estimate is about 1 million people have Parkinson's in the U.S. And another 10 million people worldwide. It is a disease of aging. It's the number one risk factor for Parkinson's, and the average age of onset is about between 60 and 62 years of age. We do expect that Parkinson's and the number of people affected by Parkinson's will grow, particularly in the United States as our population ages, and that's likely to occur worldwide as well. There's some prevalence studies that are trying to understand who is affected by Parkinson's, but what we know is that it affects people from all backgrounds, all ages, all races, men and women are roughly approximately equal. It's an unfortunate disease, but it affects everybody around the globe.
Is it related to Alzheimer's in any way?
Yeah, it's a really great question. There are some similarities between Alzheimer's and Parkinson's, though they are distinct diseases. One thing about Parkinson's is that, at the very basic science level, there's a misfolding of a protein in both of the diseases. Different proteins for sure, but what that tells us is that as we're doing basic science, we can look at the same mechanisms that are affecting people with Alzheimer's and the same mechanisms that are affecting people with Parkinson's. So there's a lot of research that's going to be done in Alzheimer's and Parkinson's that are going to have benefits for the other disease.
Does being a geriatric practitioner qualify someone to deal with Parkinson's? I know that there are special needs for, say, Alzheimer's patients. Are unique needs a problem for those suffering with Parkinson's based on the training or lack thereof of the people that are caring for them?
Yeah, what I would say is yes. And the reason is Parkinson's is a very complex disease. Most people think of Parkinson's as a degenerative neuromuscular disease, and that is absolutely true. But there are so many other parts of the body that are affected: cognition, mental health, sensory, sleep, the GI tract, So what we've learned over time as our science has advanced is that people with Parkinson's can have a number of different complications. And so having access to what we call a movement disorder specialist, somebody who's done extra training beyond their medical degree, to be seen by somebody who's a movement disorder specialist, we've demonstrated that the outcomes for people who will get that type of care or that level of care, particularly in a team-based setting, tend to do better than other folks. That's not to say you can't get great care everywhere. But that what we believe to be optimal care is often, delivered by people who have this extra training.
Does the Parkinson's Foundation make any strides towards that training for physicians? Is this something that you make readily available for them, either at their site, or can they get in touch with you and come to your location?
Absolutely. Part of what our fundraising goes to support and our programs are, we support a number of fellowships for movement disorder specialists at their academic universities across the country. So one of the special things about the Parkinson's Foundation is that we have a Center of Excellence network, multiple sites all across the country at Tier 1 academic medical centers. And we are supporting the training of movement disorder specialists at a number of those institutions. We'd like to do a lot more of that, frankly. It is restricted by just how much money we have on hand. But the more people who have movement disorder training, the better the care is going to be overall for everyone.
What are some of the criteria to become a center of excellence?
Yeah, so we have a whole series of things. One, you have to have somebody who is a physician on your staff who has been trained as a movement disorder specialist. That's the number one and most important criteria. The other is that you have a team-based approach to care, that you do academic and clinical research. There's a number of other criteria, and we're very pleased with our centers of excellence. We know that they deliver a very high standard of care. There's a number of other organizations, academic medical centers that are interested, and we'd like to expand that network as well. We have that network not only here in the United States, but there are centers of excellence in Canada, in Europe, and even in the Middle East.
What about in any of the lesser developed regions of the globe? Are there any plans for expansion into those areas as well?
Yeah. So we are truly a global organization funding research all over the world. We have some we're doing some exploratory work in what I would say are the developing world. We absolutely know that there's a need in those countries as well. I think just understanding the prevalence of Parkinson's in the developing world would be an important first step. But we are in discussions with a number of different countries. For example, in Morocco, we've been talking to people in Cuba about opportunities to not necessarily initially have a center of excellence, but how we can help them elevate the standard of care.
This network of centers of excellence, are each of these centers involved in research and initiatives, I guess, across the board as those initiatives and research relate to Parkinson's, or does each center have a specific, I guess, for lack of a better term, task as far as research in their area of the world or their area of expertise based on staff?
Yeah, so that's a great question. There really are a number of different types of research. Basic research, which is, laboratory animal model research, really trying to understand the basics of Parkinson's. There's clinical research, which is looking at outcomes of patients over time. Epidemiological research, which looks at how people across populations are affected. And there's drug discovery and development, where research is being conducted to see whether various therapies have clinical benefit. So a number of the centers of excellence within our network are doing all of those different types of research. Some are doing one or two, but all of them are in one way or another participating in research. That's a criteria that we have. One of the things that Parkinson's Foundation does is we have the largest clinical trial in Parkinson's outcomes research, the Parkinson's Outcomes Project. Currently, we have about 9,000 people with Parkinson's who are enrolled in that, and it's allowing us to study people's treatment and care and health and well-being over time. And many of our centers of excellence also participate in the Parkinson's Outcomes Project by providing data.
What types of initiatives is the foundation involved in to make the cost of Parkinson's care lower for the caregiver and the patient as well? Yeah,
so we participate in a whole range of advocacy efforts, both at the national and at the local level. We are a strong supporter of the aspect of making sure that people with pre-existing conditions are covered by their health care. We do know that cost of care is an issue that people with Parkinson's and other chronic diseases face. So we're actively working on trying to figure out ways to deliver care in the most cost-effective but also beneficial way. I believe that really is one of our long-term priorities. We want to make sure that the standard of care rises and that people have access to that standard of care, because people can live well with Parkinson's. It's a difficult disease for sure, but provided the right treatment, participating in exercise, people can live their lives to the fullest, and that's what we're here to make sure.
Now, where can we go and get some more information online about the Parkinson's Foundation?
So we have a website, parkinson.org, and we have another website, pdf.org. Both of those websites will provide information from our two legacy organizations. By the end of this year, it'll be parkinson.org where people can go to get all the information.
Well, I thank you for sharing with us today, Mr. John Lehr, CEO of Parkinson's Foundation.
Thank you, Neal. It really was my pleasure.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure to visit our affiliates page when you visit us at healthprofessionalradio.com.au and hpr.fm.